Hey everybody, welcome to our Facebook Live. My name is Sinai. I'm one of the faculty pulmonologists at the Mount Sinai National Jewish Respiratory Institute in New York.
And thank you for joining us. What is asthma?
So asthma is a chronic respiratory disease. Mostly it affects the airways in our lungs. And it's a chronic disease that many people in the United States and all across the world have to deal with.
Are there different types of asthma?
There are different types of asthma, and this is something that we've had greater appreciation for over time. We realize that asthma is almost an umbrella term, and there are many different kinds of disease, or what we call phenotypes, different levels of severity, different kinds of disease that affect different types of populations, and certain diseases that are related to asthma, such as allergic conditions. So we're learning quite a lot more about that recently.
And are you born with asthma, or is it a condition that
So we think that some children are born with asthma, either because of what's happened to them during development, or perhaps they've inherited it from their family members. But then we also have found that there are certain types of asthma that develop later in life, in adulthood.
Okay, great. What are the symptoms of asthma?
So people present in many different ways. I've had patients tell me they get short of breath, that they get some form of chest tightness. Sometimes you'll hear wheezing, but that's not always the case. And what we see in kids oftentimes is just cough. So it triggers us as pulmonologists to consider many different kinds of respiratory symptoms as potentially being asthma.
And what is an asthma attack?
So an asthma attack is a flare-up of your disease. So when you have asthma, you have asthma your whole life. It's not something that you can get rid of or cure, but mainly just keep under control. And when you have a flare, that's when you lose control of your disease. And this might present as somebody who has worsening respiratory symptoms. If they're exposed to a particular trigger, which normally triggers their asthma can flare, and they'll be noticing that they have more shortness of breath or more symptoms, and these flares unfortunately can be life-threatening.
And how does an asthma attack affect the body?
So what we think is going on is that the lungs get inflamed, particularly the airways that branch out into the different parts of your lung. We think that the inflammation in the lungs causes the muscles around the airways to constrict, and it really affects the way that air can flow in and out of the lungs. So we think that in a way, an asthma flare is like an alarm system in the body to say that there's been some insult or inhaled substance which is causing the body to react to in an abnormal way.
And can asthma be treated? If yes, what treatment options are available?
Yeah, we've been fortunate that there have been emerging therapies in asthma over the last couple of decades. We generally think of asthma therapies as falling into one of several categories. One is what we call rescue inhalers, which are inhalers that help you get out of a tricky situation if you have a symptom, but they're very short-lived. And so for people who have chronic asthma, we oftentimes need to give them medications that are longer lasting, and we call that maintenance therapy. And then over the last several decades, we've developed even more long-acting medications that affect your immune system. We call these biologics, and we've been fortunate that many of these biologics address the upstream inflammation that's going on, so that we can keep severe asthma under better control.
And is asthma curable?
I wish it was curable. Unfortunately, we don't have a cure for asthma, but the best we can do is to keep it under control as possible.
And can asthma be prevented? If yes, how?
Asthma can be prevented, I think, if we are very careful about what kind of environment we live in. Certainly we're learning more about this, but we are finding that certain early life exposures to chemicals and pollutants can generate asthma later in life. And so part of our efforts have been to try to minimize those exposures early on before they become a problem.
And now that we have entered spring, can allergies irritate a person's asthma condition?
So unfortunately, yes. People who have allergies, those allergies sometimes trigger an asthma flare. And so our advice is to try to keep your allergies under control. We know that allergies that affect your upper airway, like your nose and your throat, can cause inflammation that then trickles down into the chest and trigger an asthma flare. So the bad news is, yes, it can be related, especially in those people who are sensitive in that way.
And what are any tips or advice you can offer to those living with asthma and their loved ones?
Right. So I often tell my patients to do a few things. One is I tell them to look really carefully at the environment around you. We take a lot for granted, but living in New York City, we're exposed to pollutants, we're exposed to secondhand cigarette smoke, a lot of things that are in our environment that we don't realize are triggers. So definitely avoid those. I would also say to be sure to be adherent to your medication so that you take it correctly, and especially the maintenance therapies that we require that you take them every day to keep your asthma in check. And we know that if your asthma gets out of control, that can have lasting effects. And the third thing I would say is to keep your doctor informed of your asthma. Don't wait until it's a big problem. If you start noticing that your asthma is getting out of control, to talk to somebody as soon as possible.
And lastly, at what locations can you get treated for asthma at the Mount Sinai Health System?
Sure. So we at the Respiratory Institute have 2 locations. One is on the 102nd Street location uptown, and we also have a downtown location in Union Square. That's where you can find us.
Awesome. Thank you so much for joining us and informing us today about asthma.
You're very welcome. Thank you.